Hello, and thank you for joining the POCUS Academy for today's POCUS Bites webinar. I'm Maddie, and I'm our facilitator today. We're now starting, so all lines have been muted. Please use the chat box for any questions or comments that you have throughout the webinar. I would like to invite you to our next webinar on August 28th, where we will be discussing athletic trainers and POCUS. Register today by going to www.pocus.org to save your spot. Today's webinar, we have two incredible speakers, Jeannine Noble and Malka Stromer from Sound Sports Imaging. Jeannine received her physical therapy degree at Arizona School of Health Sciences. In the final semester of school, she was introduced to musculoskeletal ultrasound and found it to be a unique specialty in ultrasound that incorporated the anatomy background of physical therapy. Jeannine has performed too many scans to count in multiple specialty practices, including orthopedic, physical medicine, rehab, and podiatry. Malka is a registered diagnostic medical sonographer whose clinical skills were fostered at the University Health Network and Mount Sinai Center of Excellence in Obstetrical Ultrasound. Malka has spent the past 13 years of her career sharing her enthusiasm for sonography as a professor, first at her alma mater, Mohawk, and then at Gateway Community College in Phoenix, Arizona. Malka has spoken at various professional events and educational institutions on topics including sonography of the bowel and her research in the ethics of obstetrical ultrasound, and has won research awards through SDMS and the John and Suzanne Rusch Excellence Award through the League for Innovation in the Community Colleges. Malka and Jeannine are owners of Sound Sports Imaging, and together they now teach POCUS and RMSK ultrasound to healthcare professionals around the world, and we are honored to have you with us today. Thank you, Jeannine and Malka, for being here.
Thanks, Maddie. Thanks
Thank
for the
you, Maddie.
introduction, and thanks for having us. So our topic today is integration of ultrasound into medical professional education. And before we really begin, I'd like to, I guess, put a face to a voice and a name. So on the left, if I'm me, Malka, as Maddie introduced me, I am a sonographer by trade. And a sonography educator. So I've taught ultrasound for 13 years, teaching diagnostic medical sonography. And Jeannine is on the right, and she'll say hi.
Hi, I'm Jeannine. I am a physical therapist by education, but started doing musculoskeletal ultrasound about the time I graduated. So I've been doing this for about 20 years now, and do both scanning in office and a lot of education and training.
Great. So what we wanted to do today was we wanted to paint a picture for you about ultrasound in medicine that's taking place in Canada and the United States. And so I wanted to start off with our profession of diagnostic medical sonography. Now, diagnostic medical sonography, the program is typically a 2 to 4 year program, many of which are considered postgraduate. What that means is either post-associate's degree or even post-bachelor's degree. And oftentimes, even programs that are not of these sorts, the prerequisites are enough in order to be a postgraduate program. So a 2 to 4 year postgraduate program. They contain general, vascular, and cardiac programs are available. Many of the programs, especially if they're up to 3 or 4 years in length, will incorporate all aspects of ultrasound. Sonographers also have to learn different specialties, such as potentially breast ultrasound, pediatrics, fetal echo, musculoskeletal, vascular. So they have an opportunity to sit for numerous certification and specialty exams. Now, sonographers are trained to acquire diagnostic images and provide technical impressions to the radiologist or overseeing physician. It is not in a sonographer's scope of practice to provide a diagnosis, just a technical impression. It is also a requirement for continued medical education to maintain credentials. So sonography is, sonographers are highly educated individuals that are continually in education to keep up to date with current technology and current practices. So those are sonographers. Let's look at radiology and radiologists. So radiology is typically a 4 to 5 year residency. So following medical school, people interested in radiology will take this 4 to 5 year residency program. In that 4 to 5 year program, 5 to 6 months are spent in ultrasound. And the outcome, program outcomes for radiology resident programs are for residents to demonstrate competency in ultrasound skills required for general ultrasound, including the ability to perform and interpret ultrasound of the abdomen, pelvis, small parts, peripheral vascular system. They also are required to have an ability to advise the technologist or diagnostic medical sonographer regarding special views or parameters required for certain cases. They also need to have an understanding of the strengths and limitations of ultrasound as compared to other cross-sectional modalities. So in this 5 to 6 month training, they have a lot of program goals, objectives, and outcomes. So what's happened is in 2001, the American College of Emergency Physicians actually adopted the first set of point of care ultrasound guidelines for clinicians to use in the emergency room. On top of that, in 2007, the American Council of Graduate Medical Education mandated procedural competency for all emergency residents in emergency ultrasound, as it is considered a skill integral to the practice of emergency medicine. So we have sonographers, we have radiologists who are reading and potentially performing ultrasound, and now we have emergency docs required to be skilled in the practice of emergency ultrasound. What next? Ultrasound, therefore, in medicine as a whole. So the AIUM is the American Institute of Ultrasound in Medicine, and it's an organization dedicated to the safe and effective use of ultrasound in medicine. And so they have had a push for ultrasound in medical school education nationally and also internationally. Interestingly enough, however, this is typically a student interest group driving the need for medical school education. On the AIUM website, they provide a toolkit for ultrasound curricular integration. They also list medical schools on their website that have some form of ultrasound in their curriculum. They even provide an example curriculum from Ohio State, their MD RDMS program. So there's tools directed toward medical schools and medical education on the AIUM website. However, there's no standardized ultrasound curriculum in medical school education. And so through this kind of development of ultrasound and ultrasound in medicine, you know, there's an understanding that there are changes in healthcare delivery and the need actually for curricular modifications. So where are professors going to go to gain knowledge of best practice in ultrasound and ultrasound integration? So I want to present to you what we've been working with Midwestern University, Arizona College of Osteopathic Medicine, and A.T. Still University School of Osteopathic Medicine. These two schools recognized that there are changes in healthcare delivery and needs for curriculum modifications. They developed a train-the-trainer approach for their professors and their clinical faculty. And I want to thank Dr. Charles Finch, who's an emergency room physician, Dr. Randall Neidham, an anatomist, and Dr. Inder Macon, who's a clinical ultrasound imaging professor, for working with us and for allowing us to be involved in what is now a 3-year partnership for what we've termed a faculty development series. And so I just want to describe a little bit about what we're doing with these particular medical schools. So in our first year, we actually just basically provided an introduction to ultrasound. And in our second year, we had clinical-based applications. So we were able to come up with certain requested topics, add a clinical application, and present ultrasound in that respect. And we're going now into our third-year partnership with these two universities, with this year focused on a POCUS certification focus. I guess that rhymes a little bit. POCUS certification focus. And so we would like now all of our participants who are actually anatomy and physiology faculty, clinical faculty, and community preceptors, along with the student ultrasound clubs, to potentially get enough ultrasound skill to be able to now sit for the POCUS certification examinations. And we're very excited about the interdisciplinary approach that these schools have allowed us to be involved with. Us as sonographers teaching anatomy and physiology faculty, clinical faculty, preceptors, and students, which is super, super exciting. And now with this methodology of the faculty development series, Midwestern has been able to fully integrate ultrasound into their 4-year program, including an ultrasound elective taught by sonographers. So we're really proud of this program that we're involved with these schools in Arizona. Now let's have a little bit of food for thought. We now know that there are very inexpensive handheld units that are easily accessible. There are reimbursements available for POCUS. Practitioners can see the potential for enhancement of patient care through quicker diagnoses, immediate intervention based on findings, decrease in healthcare costs by reducing additional testing, additional appointments, etc., creating more effective care plans, reduction in procedural errors, just to name a few. So many other healthcare professionals are seeing the benefits of how POCUS can enhance patient care. There is an expectation now to utilize POCUS due to the research benefits. And there are certain healthcare professionals that have the best basic knowledge to actually perform certain ultrasounds over healthcare professionals. And I'd like Jeannine to talk a little bit of, for example, physical therapists and musculoskeletal ultrasound.
Thanks, Malka. Physical therapy is an anatomy-based discipline. So physical therapists, we're looking at the musculoskeletal system. Say a patient comes into your practice with shoulder pain or elbow pain. You use your objective testing to determine what's going on. But with the addition of an ultrasound, you can come to your clinical decision a lot quicker without having to go through 6 weeks worth of therapy. You can get to it immediately and determine what exactly is going on. Is this something I can treat in my practice? Is this a large tear or something that I possibly need to send back to the referring provider? Again, as Malka had said, it's going to be a matter of reducing patient costs and insurance costs and to getting the patients back to treatment better. This is also helpful in the workers' comp arena, where providers are trying to get workers back to work much quicker. This allows us to just shorten the time of treating patients and getting them back to work or getting them back to functioning as they need to be. This is also with physician assistants, with nurse practitioners, and a podiatrist. Any provider can be using this to help get to their treatment quicker.
Thanks. And with, as I mentioned, with the AIUM, their main focus is ultrasound in medical school education. So what the missing link here is for these other professions is education. These healthcare professionals, such as your nurse practitioners, your PAs, PTs, all the listed, previously listed medical professionals, are all playing catch up, looking to continuing education in order to be prepared for their clinical practice. They can go to a weekend course to catch up, but that does not provide the skill level or continued mentorship. You can have faculty of these programs go to a weekend class and then with an expectation to come back and teach proper practices. That's quite interesting. Now, what I have here is, the fact is that ultrasound education, we believe, is now at a point where it should be integrated into these other medical professionals' education as well, not only medical school. And there are teaching essentials. Ultrasound is anatomy. It also is physiology. So in order to teach anatomy and physiology, ultrasound can be included in that. Obviously, pathology, guided procedures, et cetera, et cetera. And I took this from the accreditation standards, 4th edition for PA programs, just to state an example of what these accrediting bodies are looking for. And it's stating that the curriculum must be of a sufficient breadth and depth to prepare the student for the clinical practice of medicine. The program curriculum must include instruction in technical skills and procedures based on current professional practice. So instead of having these professionals have an expectation of continuing education in short, quick courses, it is possible to potentially use our faculty development series methodology applicable to all of the above schools and potentially more. So I think it's very, very important that education be included in all of these, looking at the way that healthcare has changed and how everybody states that ultrasound is the new stethoscope of medicine. So I wanted to share with you a few pictures of our love of education, graduates of sonography, sonographers teaching physicians, and physicians teaching physicians. Students will end up teaching others, student mentors from higher years. We've seen that within the medical school development series, as well as the ultrasound clubs that have developed. It's become a train-the-trainer methodology. And so I hope today that you took away a little bit of the education that is involved in sonography professionals within medicine and healthcare delivery, and how integration of ultrasound into medical professional education is vital. So thank you very much. And I think we can take some questions now.
That was absolutely wonderful, Malka and Jeannine. Thank you so much. I learned a lot, and I loved listening to your excitement and your passion as you guys talked about that. So thank you. We have had a couple of questions that have come in. If there are more questions, please send them through the chat box. We have about 10 minutes for Q&A, so I think we have some time if additional people want to submit just a few more questions. But the first question that has come in is, what do you think about wireless handheld ultrasound devices?
Well, that's a great question. As I stated before, the ultrasound obviously is getting smaller and cheaper. And I think I think it's amazing that we have this ability to have handheld wireless ultrasound units. I think some of them are actually getting quite good. And I know, at least, and Jeannine and I have talked about this many a time, and just in our work with healthcare professionals, when you start out utilizing these current smaller handheld units and compare them to the radiology workhorses, or even the kind of middle of the road priced ultrasound units, there is a significant difference in quality still. And I think from an education standpoint, what that means is it's probably best to learn normals on a good quality machine, and therefore have that comfort level of when going to practice and utilizing it for diagnosis, that the handheld machines can then be used after the fact. But to learn on the handheld machines, wireless handheld machines, can be quite challenging because normal may not be as easily detectable. Jeannine?
And we've talked quite a bit about this too, that the nice thing about this is with the portability and then also the less expensive price, the handhelds have allowed ultrasound into the hands of more people too. So if you're considering ultrasound, this might also be a good way. You can, because we've talked about it as a screening tool, that you may not be able to see the depth of pathology that you might on another machine. You still can get a fairly good image of what's going on. But Malka is correct, to really learn and to get a good idea, the bigger machines that with a better image is the best way to learn.
Great, thank you. Another question that has come in is, do you have any suggestions on demonstrating the role of understanding POCUS to radiological professionals? I'm sorry, suggestions on demonstrating the role of athletic trainers to understanding POCUS to radiological professionals. I'm not sure if that question makes sense to you, but I will just kind of pop that out there.
Yeah, I think I'm going to pass this over to Jeannine, but I think what this question is asking is, or maybe stating, is that kind of a hierarchy in the medical world, and looking at the value potentially of athletic trainers doing point of care ultrasound, and the radiological professionals look on that. Jeannine, is that your sense?
Yeah, that's it. That's when I read the question, I kind of thought that too. Again, athletic trainers are in a unique position with the musculoskeletal. We're looking more at as we go to the APCA, we're looking more at an RMSK, which is the Registry for Musculoskeletal. It's a little different than the POCUS. POCUS is pretty not detailed musculoskeletal. So ATCs, physical therapists, chiropractors, that kind of group, we're looking more at musculoskeletal systems. So there's a little higher certification for that. The ATCs, I think it's quite possible that they can learn, again, the anatomy knowledge that the ATCs have is extensive. The learning is the same as any of the rest of us go through. It's learning the ultrasound anatomy, but I think that it can easily be shown to the radiologist that you are fully capable of being able to perform these exams to the state. It's a matter of taking the time to learn and to do it properly to get the correct training in this. But we've had a program over at AT Still in the athletic training department that they have an entire semester dedicated to musculoskeletal ultrasound. And the ATCs are just amazing at picking this up and knowing what they're doing with this. So it's fully within the scope of ATCs to do this.
Great, thank you. And I would agree. I think we've had a couple of other webinars about athletic training and needle guidance and some of those. And our webinar scheduled for next month is actually all about athletic trainers and POCUS. So the person that asked that question. Tune in next month, and
Yeah.
I think you'll get some great answers there.
Perfect.
We've had a couple of other questions come in, so I'm going to just jump around a little bit. Mostly people, it seems like, so I think I can answer 2 or 3 of these questions with just one question. It looks like people are looking for resources. Do you have resources for those that already have POCUS programs and they're looking to grow their POCUS program, or resources for those that are looking to start a POCUS program? What resources do you have that people could utilize?
Oh, well, perfect. First off, we would be happy to be able to assist you in any way with regards to either the development of an integration into the curriculum for your specific programs. And secondly, again, an aspect with regards to medicine is the AIUM, the toolkit that I had mentioned before. It's a great toolkit. It's basic, but it provides information with regards to specific courses that it would be applicable to. But Jeannine and I would be happy to work with anybody with regards to the development of curricular integration.
Thank you. Kind of along the same lines, another question that has come in is, so you're talking about curriculum integration. Somebody wants to know, when is the best point to introduce ultrasound to medical students? Preclinical, clinical? And then they continue to say, considering the fact that a preclinical student may have next to no exposure to pathological subjects.
Right.
Okay,
what we've learned is that preclinical is the best, starting actually in anatomy.
in the
So
first year.
teaching anatomy, anatomy has historically been taught with cadavers, and it's interesting to get feedback from students that we work with that they see anatomy actually a lot better when learning it through ultrasound than cadaveric even. And so just from the basic anatomy class is the best way to start ultrasound. And from that point, that's kind of the foundation of all of these schools is anatomy and physiology, and then take it to the clinical piece with regards to pathology. Now, ultrasound really with POCUS is normal. If we don't know normal anatomy, somebody is not going to pick up abnormal. So the key is normal anatomy. So starting it from a preclinical point is key.
We'd also had one of the programs that we had worked with did a little trial with teaching. They picked different ones in the class, and one group had just cadavers and then pictures and the models. And then the second group added ultrasound with that. And I think it was for foot and ankle and maybe shoulder. And what they learned from that and the deeper understanding they got for seeing it in action was incredible. They were able to view, once you've seen it on a cadaver, you know how it moves on the outside, but to actually see that move. The other thing is, if you start early and in the first semesters, you also get them to learn to use the machine. So you overcome that, because there are some things that take more time: orientation, what you're looking at on the screen, how to hold the probe. So the earlier you introduce that to the students, the better off you're going to be too. So by the time they get out into a clinical, and we've seen that with the third year students at Midwestern now, they're really good. They started out with knowing just minimal, and now are training the other students. They come in and they're proctors for them when they have their courses. So it's vital to start with when they first are doing anatomy.
Thank you. I think we've had some really fantastic questions that have come in. There are a few more questions that we're just not going to be able to get to at this time, but for those of you whose questions we have not yet answered, I will be able to reach out to you individually. So thank you for submitting those, and I will be sure to either follow up with you directly or have our speakers touch base with you as well. So thank you everyone for your questions. There's one final question that has come in. I think we have time for it because it seems like a quick one to me, but I could be wrong. What companies, or do you have any suggestions for which companies that provide ultrasound technology are the most education friendly? And if that's not a quick one or easy one to answer, we can also pass.
I think I'll give a quick answer for this. I think that most ultrasound companies now are actually getting out of the education realm. There used to be a kind of a team in all of these companies to provide education, but they're moving away from that, and they just have their applications to work with the machine alone. So that's my quick answer. I don't know if Jeannine has anything to add to that.
No, that's pretty much true. I was going to say your best way, if you, yeah, the ultrasound companies are getting away from that and leaving it to groups like ours or to others that are out there to provide education, because it's taking such a broad approach now.
Thank you. Jeannine and Malka, this was absolutely fantastic. Thank you so much for being with us today. A recording of this, of course. For those of you that are listening, a recording of this webinar will be made available on the POCUS.org website. And for more POCUS talks, please check out our podcast, our blog posts, and of course, follow us on social media where we post regular clinical challenges. I appreciate all of you being here today, and one more thank you and virtual round of applause for Jeannine and Malka. And I look forward to having everyone join us on August 28th.
We'll be there.